I know that Lynette, I have pictures of her, and, you know, I'm just a totally different person.
But it's not just the number on the scale that's changed. After 2.5 years using a GLP-1 medication, this 55-year-old grandmother says she also has a new attitude and a new legal name.
My name was Lynette Ashley, and now it's a neurosophronia. It's like kind of a Greek goddess thing. I felt achieved, I felt victorious, so I kind of reinvented myself, and I don't know who that person is.
Caitlin Arbor feels the same way about her weight loss, even though she did it differently. She chose gastric bypass surgery at Emerson Hospital to help her reach her goal.
It's hard work, I'm not going to lie there, but it was the best thing I did for myself.
At age 35, she went from 258 pounds to 125.
I enjoy these healthier choices that I'm making.
Right now in the U.S., there are more than 100 million adults with obesity and 22 million with severe obesity. Their risk for developing type 2 diabetes, heart disease, and certain cancers is significantly higher. They're also more likely to struggle with bone health and reproduction. But getting medical help isn't easy, even though it's available.
It's hard to come in here. A lot of patients have a lot of shame. They feel like they failed.
Dr. David Lotz is a bariatric surgeon at Emerson Hospital.
I think the most common question for me is, does surgery make sense for me?
He encourages people with obesity to ask themselves, how much weight do I need to lose? Is my obesity causing other medical problems? And what long-term changes am I willing to make to be successful?
If you want to lose 20 or 30 pounds, I'm not sure you really need surgery. If you have diabetes, sleep apnea, severe hypertension, some of the other medical problems that we see with weight, that does increase the risk to your body and your longevity. And so I do think it makes sense under those circumstances to consider more aggressive treatment options.
But Dr. Lotz says the most dangerous decision you can make is to do nothing.
They really think this is their problem and they should be able to solve it. And the data shows that you can't.
Today, there are more opportunities to see what different options can offer. Caitlin is now running road races nearly every week.
If I could wear all of these, I would.
And Anira Sophronia is walking upstairs without her cane.
I just knew that I had a lot more to offer than the hole I was digging for myself.
Well, experts emphasize surgery and medication are both tools. There's still no magic pill to lose weight, at least not yet. But if you are ready to make a change, you don't need to struggle on your own. A doctor can help you do it safely and effectively. I'm Jessica Brown, WCVB News Center 5.